topic today is women in dentistry. And the truth is that I don't want to bore you with too much of women in dentistry, whether it borders women in dentistry, then going on to feminism, or can it strike an equal balance between gender equality? And of course, I'm glad to see all the young faces, the PG students, the undergraduate students, and welcome all to this small platform in which I present a few of my ideas. I won't take much of your time. I'm sharing the screen. I hope you can see this. Is it visible? Can you let me know if it's visible or not?
Yes, I need to put the full screen.
Yes, I will. So the topic I'm going to talk about today is women in dentistry. And I was just telling Abhi sir, I'm actually feeling nostalgic seeing all of you in sweaters and coats, because it is ages since I've worn a sweater and coat, except when I go to a hill station. Here down south in Kerala, we are sweating and perspiring. But there, you're freezing, I think. But again, let's just continue with the topic. Women in dentistry. Now, when we go ahead with this, I don't know, I'm not able to change my...
Please go ahead.
Yes, I'm not able to change my... just hold on. Not able to change my... Yes, coming on to this, I think this is a common picture seen everywhere. The life cycle of a woman, or even when we go for a man, from an infant to a little girl, finishing school, completing college, then a profession or taking on a profession, and then getting married, becoming a mother of many, then becoming maybe a mother-in-law, and finally a grandmother. So there are so many roles to play: a daughter, a sister, a mother, a friend, a cousin, and a mother-in-law, and a grandmother. And of course, it all can be summed up as a woman being a homemaker in the sense looking after the house, caregiver for her children, for her husband, for her in-laws, and at the same time juggling a profession, any kind of profession.
I'll tell your brother to wake you. You're not getting up. It's coming to wake you.
Somehow I'm not able to change my screen. Excuse me, just one moment. Yeah. Now, when we go on to women, is it talking too much about feminism, or can we just talk about gender equality? Because through ages, women have faced a lot of prejudices, biases. We all know that we come from an India where a woman is revered as a goddess, with Saraswati, Lakshmi, Durga, etc. But we also come from an India where women have been killed because of dowry, because of sati, okay, because of female infanticide. The host has disabled my screen sharing.
Just one second.
I kindly request everyone to mute your mics, please.
Just one sec. Yeah, I'm just doing that. Sorry.
That's okay, sir.
Yeah, we're trying to mute everyone. That's what was others. Okay, fine.
That's fine.
Ma'am, you can share your screen now.
Okay, I can share my screen. Yeah. Okay, hi. For those who are new, I'm Sarah Christopher, and I was just talking about women as such, and women in India, they have been revered. That means women as such, we have goddesses like Lakshmi, Parvati, Durga, etc. But the same women and many of the women have died because of dowry death, because of sati, because of female infanticide. There's a book by Gunjan Jain known as She Walks, She Leads. And in that, she's talked about some success values. And it's actually very interesting to know some of it. Swimming against the tide, that means being different. It's very difficult to be different. It's easy to just go along with everybody else. So think different, be unique. That is what exactly she means. Get out of your comfort zone. See, when you're comfortable with the surroundings, with your environment, you tend to be stagnant. And that stagnancy sometimes leads to your downfall. Stay positive always. Sometimes it's very difficult to stay positive, especially when negativity is all around and you feel that it is difficult to understand why things are happening, especially if something wrong happens. But staying positive is a big aspect of getting ahead with a successful life. Never be complacent, same as being with a comfort zone. Always look for something new, something better, so that you can go ahead and do better things. Be an eternal student. That I myself have learned. That means you have to learn to learn things, unlearn things, and relearn things. That is something that we need to do. If something is new, if we need to get updated, we need to do that, especially in our dental field. Then, of course, be mentor and ready to be a mentor also. And be mentored also. You should be ready to understand a guru and be a shishya, as well as you should be able to mentor others. Cultivate a social conscience. That means you have to understand the environment that you are in, the situation you're in, and try to adapt accordingly and strike a balance between everything. I was born in the 1980s. So the girl child or the women then and the girl child now, the perspective is so different. What my mother told me and taught me then, and what the present mother, I as a mother, is telling my child is so different. Before, our activities or our fun activities was running around the house playing badminton. Right now, my son's fun activities is sitting in front of the TV or even playing a video game. So the perspective always changes. I'm sorry. I'm not able to change my screen every time this comes up. I don't know if it's my internet or is it something else. Anyway, coming on to the next very, very important aspect, women in dentistry. Changing role of women in dentistry. A little bit about the history. I don't want to bore you much, but this is a list according to the journey of women in dentistry, given about all those who have been pioneers and who have changed dental profession from the 1800s to the present 20. So Joseph and Sarah, a little bit about their history so that you understand the struggles that women have gone through over the years. Sarah is supposed to be a dentist who received the first degree in dentistry from the University of Estonia in 1814. Her struggles are impeccable. Then you have Lucy Beeman Hobbs Taylor in United States from the Ohio School of Dentistry in 1866, receiving her first degree and the first woman to receive a degree in United States. Then you have a very pioneering lady. Her name is Emmeline Robert Jones. She was actually the wife of Daniel Jones, who was a dentist practicing. And the beauty of it is she was his assistant. And he kept on telling her, women can never practice dentistry because they have clumsy hands. But she watched, she waited, and one day she showed her husband all the beautiful fillings she had done on extracted teeth. And then he understood that, yeah, maybe she was way better than him in many things. And in 1864, she continued his practice even after his death. So she was one, you can say, successful dental practitioner. Then coming to our very own India, we have Fatima Jinnah. Fatima Jinnah, the sister of Muhammad Ali Jinnah. She was the one dentist before undivided India. Vimal Sood, 1944, the first woman to get a PG degree in India in pediatrics from the University of Minnesota. And she practiced even till a few years before. Now, this is a picture I came across. It is actually in one of the then published articles or journals in which they showed the profession, women in profession. The first picture shows a woman assisting a chemist, and the second picture shows a woman assisting women. In fact, not one woman, but women assisting a dentist. So basically, they tried to poke fun at women who were interested in going into any profession, be it a chemist assistant or be it a dental assistant. Now, that was just something in between before going back to the history of Lillian Lindsay, 1895. She was the first female president of the British Dental Association. Her story is also very different. The first time she went to join in a dental school, the dean interviewed her actually outside on the pavement, saying that she would distract male students. But she didn't let go. The next time she interviewed, she got through, and she became the first female president of the British Dental Association and also in charge of the British Dental Library, the journal. So she has done impeccably and very well in a very male-dominated situation. Minnie Evangeline Jordan, the first pediatric dentist, she also wrote her first book on pediatric dentistry. Juliet Southard is the founder of the American Dental Assistants Association. So these are the few ladies in the history of dentistry who made a difference. Now, coming back to dentistry, when we talk about dentistry, what all can we do? You can have private practice after BDS. You can go into academics, do a PG degree, do a PhD. You can be in the government sector, either in academics, or you can go on to be any of the various posts in the government sector, or you could be a research scholar. Now, this is an article in 2015 by Jamana Surya Prasanna, talking about women in India as dentists, the changing face of dentistry. Just a gist of it. It says that, this is 2015, 50 to 60%. Now you can say even 70% in all dental schools in India are female students or female. More female or women students are there. But only 15% of the principals or deans across the country are ladies. In 1970 or before 1970, the number was even less. So it was just 3% in deans or principals or leadership roles. So in 1970, that was maybe the turning point when more ladies start coming into leadership role. But from that 3%, it is still increased only to a 5% of ladies in leadership roles, meaning the president of associations, etc. Why is that? There are a few drawbacks of being a woman in any profession. When you talk about the dental profession and women, we can say that women in dental practice can only put a few hours of work, maybe 4 to 6 fewer hours of work a week, see lesser patients. Therefore, they have a differential pay scale. Female general practitioners and specialists, they appear more in the urban area than in the rural area. And of course, we see lesser people trying to climb the ladder and go into leadership roles. Now, there's this, when you go into the FDI website and type women in dentistry, this is what you get. Okay, FDI, World Dental Federation. All of you have heard of FDI. And there are goals for women dentists worldwide. This is a section of women dentists worldwide in FDI. It says that one of the goals, goal 1, engage, insensitize, and empower all women in dentistry to be involved in shaping and leading the profession today and tomorrow. That means you have to cultivate the aspect of leadership in the minds of women. Emphasize opportunities and showcase how women bring positive changes and innovation, that is research. Advocate for women to be equally represented and included at every level in the profession. So it sums up a lot of things. Now, the first picture here is Dr. Michelle Arden, the first woman to be selected the president of the FDI in 2005 to 2007. She became the president of the FDI. And she says that the first time she stood for elections, she lost. The second time she stood for elections, she never thought she would win, but she won. But she was one of the first ladies to take in a role of leadership after 100 years of the formation of FDI. Only in the past 20 years after her, there are 3 more presidents who came in as ladies. So you can see the discrepancy. 100 years meaning 2 years for a presidentship. That means 50 odd presidents. In that, the 51st president being a lady. So see the ratio, the struggle. So understand how difficult it's been for a woman to rise to that role of leadership and how she must have faced barriers, she must have faced a lot of problems. But she says that once she stepped into the role, she doesn't consider herself a female different apart. She is the president. She works as the president. And her goals are basically how you can make better the dental profession, make it medically oriented. If dental health is as important as medical, why not? She wanted to work on the ethical aspect of dentistry and, of course, advocate innovation. This woman entrepreneur, as you see, Dr. Paramjit Kaur, shaping the future of dentistry. This is the front page of Women Entrepreneur article 2023, in which it showcases 10 leading women practitioners. And yeah, so this is 2023. I haven't, of course, 2024 has just started. So this is one aspect. The third picture is Dr. Anita Balan. She's a Joint Director of Medical Education Dental, lady in this profession. Now, these are the few examples that I've put of women in leadership who can make a difference. But why not you and me? It is sometimes difficult to strive, sometimes difficult to work towards a goal, but it is not impossible. Excuse me, I'm not able to change, so I'm going to share my screen again. Yeah. This colloquium on career paths for women in health sciences talks about how we can promote women in not only dentistry, but in generally in health sciences, be it in the medical field, be it in the research field. It says that we should collect and publicize data to change perspectives and policies. We have to document gender bias. We have to understand the salary differences, promotions, responsibility, mentoring of women. So all this needs to be seen if you have to bring up women. Women have to understand that, yes, there is a cause of gender inequality. You have to understand it. It is not going to just fade away. We need to work towards gender equality. Move plans into actions. Whatever plans you have, move it into actions, working towards it. Cultural, political loopholes, everything has to be crossed before doing it. You should be aware of equity issues and understand women as leaders, role as women as leaders, uplift them as a woman, help them out. Guidance for newbies, be a mentor. And of course, leadership should be a part of the curriculum, our curriculum too, how to be a good leader. Collaborate with other organizations, overcoming this gender bias. And of course, we centralize and share information, policies, priorities, etc. We have to understand that unless practices, attitudes, and relations in society change, the people change, it is very difficult to promote gender equality. And of course, it is an upward struggle anyway. Now, I am from the part of the Indian Dental Association. So, without a few of the goals of the Women's Dental Council. Now, what exactly is this Women's Dental Council in the Indian Dental Association? Why was it formed? One of the reasons is if you see all across India, it is maybe now in the past 5 years that you have presidents, lady presidents coming as the Indian Dental Association branch presidents. But still in the higher level, women are still lacking and they are not able to come up to that higher level. Anyway, the Indian Dental Association in 2017 officially started something called the Women's Dental Council, where women take over, women do programs oriented for women. And some of the goals and objectives of this WDC or the Women's Dental Council is that we have to uplift women, especially dental surgeons, the new dental surgeons, understand their problems and try to help them out. That is talking about mentorship, mentoring. Then looking for women welfare, leadership roles, career oriented, special needs of women in our CDH programs, in our CDE programs, CDH for the society, CDE programs for us, for the women, to make them understand how they can come up. And of course, recognizing women achievers. When women achieve something, we need to recognize them. We need to understand their thinking, their policy, and help them to come out and come better. And of course, give a united front. Now, these are some of the programs that we have over the years conducted. That is, you have the cybercrime program, health programs, CDH programs for the awareness of the general public. Then you have self-defense programs, and of course, financial that means on my own 2 feet, that means financial security, how women can undergo financial problems and how they can overcome them. And of course, women should have fun together. That is something that the best bonds people together. Friends, have fun. Even if you have common friends in dentistry or others, once you bond in that area, you automatically tend to bring up your peers, your friends. Now, the Indian Dental Association Kerala State Branch, the Women's Dental Council, we had done 5 projects last year. Just telling you an example about how women in dentistry, we can make difference to the public. We had a program called Dentistry, in which we give awareness and care for the visually impaired. All across Kerala State, more than 20 to 30 branches, 20 to 25 branches, we actually held dental awareness camps, dental checkup camps, and treatment camps for visually disabled or for the visually impaired patients. We helped them to, for their brushing technique, we provided them with electric toothbrushes, and as such made a difference. When we come back and look back at it, and we understand what we are doing, these are sections of society that really need help. And so we reached out to them. Then, of course, for our members, we conducted a cyber safety or cyber security program. That is for the upliftment and the betterment of our members. That means women. Then we had charity programs. Now, charity is something women do very well. We get together, conducting mainly exhibitions, stalls, and taking money. That is something that women do very well. So there's something that a platform in which we could come together, make a difference. We collected almost 2.15 lakhs, and this money was given to the endosulfan victims in Kasargod area Kasaragod district, there are schools known as bud schools there, where these endosulfan related or endosulfan victims or their children are there. And we gave or distributed this money to 4 schools, and their needs, dental needs as well as other needs, were met. Then we have substance abuse awareness and prevention program, SPARK. This is something that is a very important feature of, you can say, the world today, substance abuse. And it is dragging our youth down, and we need to fight against it. So as women, we can make a difference fighting, telling not only our children, the children's friends, our society, but others too. And of course, another breastfeeding kiosk in a public place. This is something for society, making a kiosk or a cubicle in a public setting, for example, a bus stop, a railway station, where women feeding mothers can actually feed their babies in private. These are some of the programs we are planning to do in 2024. That is management of dental trauma in schools that we are planning in January end. That is how trauma occurs, how we can prevent it, and general the first aid that happens. This is for school teachers as well as students. So this is something that we can do as dentists to help the children. And of course, mother and child dental care. This is basically for pregnant women. Just a few days back, I had to do an access opening for a pregnant woman. She was 8 months pregnant, terrified. She had pain. It was a 4-8, okay, partially impacted. It is actually indicated for extraction, but still, so scared was the lady. So why not give them awareness before all this, before they come? Because the oral hygiene of many of the mothers who are especially pregnant, or the pregnant women, is always on the down or on the downfall. And of course, care for the differentially abled or differently abled patients. This is another of one of our projects. And then, of course, old age homes, older women, older people, they always need more care. We are planning to conduct a CDE on women in leadership. That means women as a researcher, woman as a academician, a woman as a entrepreneur, all this, women in dentistry. The charity challenge still continues, and Cup of Life is actually advocating the use of menstrual cups among our members as well as society, so that we can remember that we need Swachh Bharat, clean India. So I'm these are just few examples of how women can make a difference as a dentist in society. But one thing you need to know is you have to come out of your shell. You have a shell around you, you have to come out. And how do you come out? One thing is, those who are already out of the shell, you need to mentor, you need to bring out all your friends who will help. You can understand them better. With all this, I would not bore you much, but I think more than 20 minutes is gone, and I can go on and on women in dentistry and how women can make a difference. But would like to conclude by saying, historically, women have strived to carve a niche in the dental profession. Presently, we are strong together and as individuals. I know it is a struggle juggling between home, profession, your children, your husband, your in-laws, but it is possible, even in a small way. The future is in our hands. We should rise to the occasion, rise to stand. So thank you all. And I thank God that I was able to do this presentation without coughing, because I am actually not feeling well. I have just recovering from a severe cough and cold. So thank you all for your patient listening. I thank all my teachers. Thank you for being here. Thank all my juniors. Thank you, my classmates. And thank you, all of you, for being here. And with this, I would end the session.